how do you determine whether you are a candidate?
Yeah, that's a great question. So first things first, you always have to come in for a consultation to determine your candidacy. And like our philosophy at Kelly Vision, and my personal philosophy too, is customized vision correction. So it's not a one size fits all approach, right? So you come in, we talk about your job, your hobbies, your lifestyle. We do an assessment of your eye shape. We also look at your prescription, and then we discuss and we come up with a customized treatment plan for you. And so specifically for someone for EVO, what we're looking at is the shape of their eye and the strength of their prescription to see if they're a great candidate.
Great. I've heard some interesting satisfaction reports. Could you please explain that in more detail?
Yeah, I love talking about this actually, because this has some of the highest satisfaction of almost any elective surgery. So 99.4% of patients that have had EVO ICL are happy with their surgery. And I also see this in my own practice too, because I'll do someone and then I'll do their brother and then I do his girlfriend and then their friend. So it's pretty incredible to see how it spreads like that as well by word of mouth, and the referral and the just like, the friend to family member referral pipeline is just really incredible, because I think when you can see firsthand what somebody goes through, you really understand the ease of the procedure, the ease of the recovery, and how happy patients are. And so I think that's why it can feel scary. And I hear this all the time from my patients, right? They feel nervous to have a surgery on their eyes. And so one of the things that I get asked the most is like, well, what if something happened? Like, I'm feeling scared, I'm feeling nervous. And it's very, very common to feel that way. And so I think sometimes when you know someone who's gone through this and had great results, it really just helps to put you at ease as well.
Great. So, let's talk about recovery. What are the general recovery timelines and what would someone experience?
Yeah, so for recovery, I always say to my patients, it's fairly straightforward. You want to take about 1 to 2 days off of work.
Doesn't seem like much.
Yeah, exactly. Yeah. It's funny. I have a friend who's a plastic surgeon, and he says for people that have a nose job, he tells them it's like a year before they get their like actual nose because of the swelling and this and that. Oh, wow. And I always think what we get to do in ophthalmology is like truly life-changing. Like, I don't throw that phrase around that much, but usually the next day people are already starting to see better and feel better. And most of my patients go back to work a day or two later.
If I was thinking about doing this procedure and I wanted to see whether I was a candidate, what would happen at the consult specifically? Yeah,
so the consultation, when you come in to see us, the first thing that we do is just an assessment of your hobbies, your job, things that you like to do. I always ask patients as well, is there a reason why it's motivated you to finally come in? Because oftentimes people will say they've been thinking about doing something for years. And then sometimes it's like they got engaged and they're getting married. They'd love to be on their honeymoon, glasses free. For other people, they're starting a new job, or maybe it's like a friend or family member had it done and they've like saw how happy they were. So it's usually something that I think finally motivates people to come in. Then we do a formal assessment of the shape of your eye. So we do very advanced imaging to really determine candidacy. Because I always say, like, the question for me is, are you a good candidate? I don't just do the surgery on everybody that wants to have it done, right? So I want to make sure that you're seeing well and feeling well for many years going forward. And that's my goal as a surgeon. So that screening and candidacy is really important.
After someone's recovered, what is their life like generally from before and after?
I think the one thing that I hear the most from my patients from after surgery experience is just how easy things are day to day. Think about travel, like not having to travel with your contact lens solution, your contacts, a pair of glasses in case something happens. And so the ease of day to day life and that whole like I can wake up and I can just see, I think is something that stands out a lot.
Why is flexibility and reversibility in this solution valuable?
Well, this is something that is so unique to EVO ICL that no other vision correction surgeries that are available have. So this reversibility factor means that I'm going to put this custom lens implant on the inside of the eye. But say if in 10 years, if in 20 years, a new technology came out and you would want that instead, or say if you ever wanted to go back to glasses or contact lenses, or if you just weren't happy and wanted to go back to what your life was before, you have the option where I can remove that lens and I have not actually changed the shape of your eye in any way. So it's completely reversible if that's something that somebody's wishing for. And I think that as well, the pace of technology is changing so much, so it leaves it open for your future too. Maybe it's a generational thing. I don't know. Like, we're a little bit afraid of commitment. Yeah. But if you are a little afraid of commitment, rather than a permanent laser that reshapes your eye, you can do the EVO ICL. It's a lens implant that can then be removed at any time.